Hello dear students, how are you? I hope you all are safe at home. Dear students, today I will teach you chapter 4 of civics. The name of the chapter is Roles of the Government in Healthcare. Right? In this chapter I will teach you what are the points there. What does health mean? Healthcare services in India. Measures taken in Bengal to improve healthcare. The role of government in healthcare. Today I will teach you half of the chapter and next half I will teach you in next video, next week. Okay students. So, what does health mean? What is health? According to the World Health Organization, WHO, right? Health concerns the overall well-being of a person and not just the absence of infirmity or disease. A healthy person is mentally and physically fit. According to WHO, who is healthy? Who is overall healthy from mind also and from body also, means mentally and physically should be fit, right? However, good health concerns other important aspects such as sanitation, cleaning, right? Pollution free environment and clean water supply, right? This all comes in health, right? Now about healthcare services in India. What are the healthcare services in India? Here are some facts that will give us an idea about the present state of healthcare services in our country. India has the world's largest number of medical colleges. In India so many medical colleges are there, right? It is also one of the leading countries in terms of the number of medical professionals qualifying every year. India is one of the world's largest producer and biggest exporter of medicines, right? Healthcare facilities in the country have secured a considerable increase over the past decades. At present, the number of hospitals in the country has crossed the 18,000 mark, right? A large number of medical tourists visit every year for treatment. Means, what does it mean, medical tourists? Means they are coming for their treatment in Indian hospitals. Maybe they are not getting easy treatment in their country. They are getting expensive there, and here they are getting cheap. Then there. So this is called medical tourism, right? They get treatment in hospitals that are rated as some of the best in the world. Now, facts regarding the state of healthcare in our country. Means this much we have, still somewhere we need more. Okay, how? I will tell you some facts. Okay, some facts are there which will give us completely different picture. The healthcare facilities in India are imbalanced. Why? where poor people have a big disadvantage. Okay, in public healthcare facilities are inadequate and do not reach the people living in rural area. Rural areas means in villages, right? Far from cities, right? Funds provided by the state government are not sufficient, right? And proper medical facilities at primary level. Primary level means just that rural areas, right? Not sufficient. Why? Not sufficient because infrastructure is not there. And they these places are too far from cities. There is a huge shortage of doctors and nurses in rural areas due to unwillingness. Means they are not ready to go there. Everybody want to live in city only. In city hospital they want to transfer, right? Lack of infrastructure means buildings are for hospitals, dispensary, proper buildings are not there, doctors not there, nurses not there, and shortage of medical facility is a big impediment in the path of rural health facilities, right? More than half people in India are living in villages, and this kind of problems they are facing. And there is no doubt that we have a large number of doctors, clinics and hospitals, money, knowledge and experience pool of professionals we have who can run various healthcare systems, but in spite of all these we are unable to provide necessary healthcare facilities to all people. Right, now about healthcare services. Right, healthcare is a matter incorporated in the state list. Right, state list. Okay, the annual expenditure is shared by the central government and state government. The Ministry of Health and Family Welfare formulates programs and policies to improve health standards, and health education is state. And the healthcare services in India are divided into main categories. Main two categories are there: public healthcare and private healthcare. Public healthcare means, what is public healthcare? For everyone. Public means for everyone. Anybody can go. The medical facilities are mostly free of cost. Like in PCI we are going, only 5 rupees we are paying for card, and injections are there, many drips are there, many tablets are there, and bed is also there, we are getting free of cost. If any private hospital we are going, too much fees is there, for everything we have to pay, for bed also we have to pay, like this, right? Under basic health services, hospitals and healthcare institutions and are captured using the money received by government in the form of taxes. From where government is spending money in those hospitals? From taxes which government getting, right? From other ways. The expenses of medicines, medical equipments and doctor's salary are given by the government from those taxes. The public health sector in 3-tier structure comprising of primary sector, secondary sector and tertiary sector. These services bring healthcare facilities within the reach of the people in rural and urban areas. An essential and important function of healthcare is to prevent the spread of diseases. like, such as tuberculosis, polio, malaria, jaundice, dengue and chikungunya, etc. Now we will talk about the Pulse Polio campaign by the government. Has certain Sundays which they organize on certain Sundays, marked as Polio Day. Right? What is this Polio Day? It is an immunization campaign established by the government of India in 1994 to eradicate polio in India. And this campaign has been successful and resulting in a remarkable decline of their disease. In this, every child below the age of 5 years receives a dose of free oral polio vaccine, free of cost, by health workers all over the country, in every state, town and district. You may have seen that we bring some children to Anganwadis or any, they make a place to sit in schools or in temples. They put some drop in the mouth of the child and they mark on the finger with marker, right? That is polio drop. Okay, so dear students, half chapter is over. The next half I will teach you in next video. Stay home, stay safe, bye.